Hello everyone. Hope all are doing well. And today's topic is PSUR section 16.5. This talks about effectiveness of risk minimization. So in this topic or in this section itself, it talks about effectiveness check on the risk minimization measures what the MAH already has taken. It means something had happened last time, or previous year, or previous review period, whatever, or cumulatively we are performing some kind of risk minimization activity, whatever it is. So it indicates, the section indicates that something minimization measures we have taken, and while writing PSUR we need to check how effective it is, the actions whatever we have taken. Precisely we are summarizing in this particular section. So the outcome could be whatever we have taken already, that could be going on the road, it is going correctly, or there might be need of some kind of alternative or some kind of changes, or we need to completely remove and we need to insert something new minimization measures. To check the effectiveness, these sections precisely talking about. As always, all the MAH writing in this particular section about from the global aspects from the headquarter level. So this will talk about the global aspects, how the risk minimization measures are, and also they will narrow down to a particular region or particular country. They will specifically they will talk about. So in this talk about in this section we are talking about only about the guideline. We are not going to any company specific or something. So whatever the existing in the Google, that is the modules, the guidelines, we are going to talk about, to limit it to that, to understand the guidance, what guidance is, what company performs, that is something individual company specific. We are not going into detail. What guideline talks about, what boundary guideline has provided, that's what we are talking here. So what it says is risk minimization activities are public health interventions. So already we have taken some measures, so we are going for a intervention to prevent, you know to reduce the preventability. Means this focusing again preventability of already what it was happened, we need to prevent that. That could be the scope, that is the understanding. And also how we have tried to reduce the particular severity, and also how we tried, what are all the measures or something we have taken to reduce that particular adverse drug reactions. So here we have tried to minimize to the severity, and we tried to prevent that particular that adverse untoward effect, or any adverse drug reactions we have talking about in this particular section. So risk minimization measures, as you know well, that routine and advanced. In routine usually they will talk about labeling changes. So here in labeling is a routine label changes, whatever we do to initially to check how the label indicates. Means label everything has been listed. In case in routine risk minimization measures, label they are updating, and they are clearly talking about you should not take with this medicine along with this and another medicine, and there is a very clearly they are talking about any warning or precaution, and through label they wanted to control the initial level of adverse drug reaction. And also in routine risk minimization there are variety of types, but guideline they specifically they talk about label. That's the reason I have stopped here. And also there are some labels, as some legal aspects like reducing the package size, and some other actions like some of the medications when the patients are taking, they are taking it in a wrong way. That's how the adverse drug reactions are occurring, or the medicines is not working, so and so those things are getting transferred as a minimization measures to go to the healthcare professional center and take through nurse or through healthcare professional or through doctors only, the particular medicines has to be administered. So those are routine risk minimization measures. And also some of the over the counter medicines that has been transferred now to a prescription medications, That's how we can reduce some of the adverse drug reactions. Those all coming under the routine minimization measures. So how well it is working now. Last year we implemented something, or previously we have implemented, how well it is going, so that we can do some kind of adjustment during this particular period, or we can propose something for the future, how well we can correct that, those indicators, how well it is working. That's how it's talking about routine. As well as there might be some advanced risk minimization measures we would have taken, like direct healthcare professional communication, that we talk about DHPC, and dear doctor letters. We could have given some directly communication to doctor stating that about the particular highlight about the particular event, when to be very caution. It could be a precaution that the healthcare professional to be keep it in mind when you are handling, or when you are treating a particular patient, particular type of patients. It could be hepatic or liver or cardio patients, or any other genetic polymorphism patients. You should be taken care and keep these points something in mind. So those things are through dear doctor letter. And education program could be to be anything to the healthcare professionals or to the patient, or that could be that way. So in risk minimization measures, these are all the points mainly they are covering. And exactly when you are writing this particular section, so the particular section may contain, or it's a boundary that the section should contain results of assessment. So how well the risk minimization measures worked in that period, so that you can if the results are available, you can provide the results. And also if the evaluation is available, even you can attach, or you can write a summary of evaluation. And also if you have anything, if you have taken anything effectiveness, particularly here in this particular section, you are focusing on in a global aspects. And after writing a global aspects, if any country specific or any region specific anything risk minimization measures, something if it have been taken, you can provide some insight. And also you can add any country specific, if that is when required to the PSU, or you can include the detailed results or evaluation through appendix also you can include, and you can add that particular effectiveness. And also any specific risk minimization measures, if you have taken particularly for important identified risk, and that limitation of that particular risk minimization, everything it should be has to be clearly presented. Example, as per the guideline, they have talking about important identified risk, and if there is something specifically, if the MAH has been taken some risk minimization measures, that has to be presented in this particular section. And the take home message could be, this could be the evaluation, the effectiveness check could be for the interval period of the particular PSU or interval period. You can do this particular activity, because every PSU or interval anyways you are going to keep performing that one. So during the focus on the interval period, how well the effectiveness are, and you can keep it in mind, it should be highly global level. And some marketing authorization holder would have taken any country or region specific, that also can be done, and appendix is allowed. And if you have taken something important identified risk, any specific measures, so you should be providing the limitations or anything to be upgraded or anything that could be presented. That's how the section 16.5 it talks about the detailed information. Thank you. We can see something in good information in the next video about next section.